Hello everyone and welcome back, my dear listeners. I'm Dr. Aman Kapoor, your host, and welcoming you to the Heart Guardian podcast. Today, we are exploring a critical topic of artificial heart valves, devices that have transformed the treatment of heart valve diseases. With us today is Dr. Hiremath, an eminent cardiologist, our expert and guide to shed the light on this subject. Welcome, Dr. Hiremath. Great to have you back on this podcast. I would request you to walk us through the mechanics of heart valves and their impact on the patient's health.
Artificial heart valves. Heart is a mechanical pump which receives blood from the body, which is deoxygenated or used up blood. This blood comes on the right side of the heart. It is pumped into the lungs for purification. Purified blood returns to the left side of the heart, and then it is pumped out again to the body. So, this is a unidirectional blood flow from the right atrium to the right ventricle to the lungs, from the lungs to the left atrium to the left ventricle, and to the body. This continues throughout life. In order to maintain the blood flow unidirectional, there are 4 heart valves: the tricuspid, the pulmonary, the mitral, and the aortic valve. Diseases of the valves are rampant, especially in India, and they can be mild to moderate to severe or devastating forms. For severe forms of valvular heart disease, usually the valve needs to be replaced by surgery, and this replacement is done by artificial heart valves. The commonest surgeries of the heart valves are performed on the left side, that is in the mitral valve or the aortic valve. The right-sided tricuspid and the pulmonary valve replacements are less than 5% of these total valve replacement surgeries. A heart valve will open and close with every contraction and relaxation of the heart. The closed valve will not allow blood to go backwards, that is regurgitation, so that opening and closing movements will continue about 80 times a minute, into 60 in 1 hour, into 24 in a day, into 365 in 1 year, and for a span of 75 years or some decades, it would mean opening and closing of the valves for millions of times. The artificial valves are tested outside the body in the laboratory for about 1 billion times. And after such a thorough research, they are introduced for use in the human body. The major heart valves, artificial ones, are bovine, that means which are made from the pig tissue. Either a pig's heart valve is picked up or the pericardium which surrounds the heart. From that, valves are made in the laboratory. These are known as the tissue valves. The other valves which are replaced in younger population are more durable metallic valves and are made of specialized steel. Most of the valves are replaced with the open heart surgery, and the deceased valve is removed and the new artificial valve is sutured in that place. The success rate of such open heart surgeries in India is close to the tune of 90%. After the successful surgeries, the valve need to last for the entire lifespan of that person. These valves need blood thinners so that this foreign body does not cause blood clot and cause disturbance in the blood circulation. The tissue valves do not need serious blood thinner, and they are managed only by 1 single dose of aspirin. This aspirin per day will look after the tissue valves as long as the tissue valve lasts. In the mitral position, the tissue valves last for about 10 to 12 years, and in the aortic position, they could last up to 12 to 15 years. The new valves which are coming into the market are designed to last longer, so they can be replaced in younger population with the convenience of single-day aspirin. Those who are younger, under the age of 50 years in India, need to get valves which will last for at least 20 years. These valves are usually metallic valves. The success rate of metallic valve surgeries are also good. These valves need to be protected by giving serious blood thinners. Once these blood thinners are given, a blood test called INR is done every month. This test checks how thin is the blood. It should be more than 2 times the normal and less than 3 times the normal, so that the valve remains without clots and bleeding in the brain or other organs doesn't take place by excessive blood thinning. If the INR is less than 2, there is a danger of clot formation in the valve and the dose of medicine needs to be increased. If the INR is more than 3, there is a chance of bleeding in the internal organs and the dose needs to be reduced. This management of the blood thinner or the Coumadin derivatives leading to INR management can be cumbersome, but with training, most of the patients are able to manage it very well. To make a generalized statement, under the age of 50 years, usually a metallic valve is replaced, and above the age of 50, a tissue valve is replaced. Every year, all the valve patients undergo echocardiography to look whether the valves are functioning properly or not. Various complications in the form of valve getting old, valve not functioning well, valve not closing well, valve getting clots, valves getting infection, and valves throwing out clots from the surfaces can take place. Fortunately, these complications are not many, and overall success rate of valve surgeries is reasonably good. Nowadays, in very old patients above the age of say 75 years, open heart surgery is generally avoided because of the high risk of the surgery and also the anesthesia. Here, the valve is replaced through the groin without a surgery and the procedure known as TAVR. The surgical replacement of the aortic valve is known as SAVR. The TAVR is done only for the aortic valve, so far at least, and it will last for about 7 to 8 years. To sum up, artificial valves are of 2 types, tissue valve and metallic valve. Which valve to be chosen is a decision which should be left to medical experts. Generally, younger patients get metallic valves because they need to be durable, and older patients get tissue valves because they get the convenience of single-dose aspirin. Tissue valves are more convenient but not durable. Mechanical valves are more durable but not so convenient because of the repeated blood tests. All in all, the valve patients can be very sick to start with, and when such a replacement takes place, they spring back to life, and the quality of life and the quantity of life can be really rewarding if some discipline is maintained and a medical follow-up is routinely done. If artificial valves get dysfunctional, they can be replaced again, which is known as a redo surgery, and nowadays non-surgical replacement of such old valves is also possible. Redo surgeries are a reality nowadays, and they can also have a reasonable success rate. If a person is living with an artificial valve in the heart, other surgical procedures like dental procedures or other operations required have some special precautions to be taken, and a cardiologist and cardiac surgeon will look after that part when required. Once again, to sum up, artificial heart valves is a phenomenal human invention, and in the modern science, this would rate as one of the highly advanced interventions trying to help nature to make human beings live longer and live well.
Thank you so much, sir. Thank you so much for enlightening us with the intervention that can really help the nature and help the people live much longer and a much better lives. My dear friends, thank you for joining into this podcast series. As always, it's a humble request to you to please like, share this podcast series and comment below with the questions. And if you're on Spotify, if you're listening to this on Spotify, make sure to drop in your comments and questions of the topics that you would like to hear from us in future. Till the next time, this is your host and host, Dr. Aman Kapoor, signing over and out. Bye-bye.